How can more federally funded research projects transform into viable commercial products? Teach faculty how to think like entrepreneurs.
The goals are to take an existing piece of research that the National Science Foundation has funded and to take it to the marketplace. For a number of years, Congress, who funds NSF, has wondered what they're getting for their investment.
What the National Science Foundation and others have done is they've suggested that they've dropped a lot of money into scientific, social scientific research, but they're afraid that when the grant cycle is over, the projects end up on somebody's shelf or they end up worse in the garbage somewhere. And so the National Science Foundation was the first group to step up and say, if you've had funding in the last 5 years, you're eligible for this funding.
They put together this program called I-Corps, which stands for the Innovation Corps, to help researchers commercialize their ideas.
NSF selected 24 teams, each with a promising technology concept, for a $50,000 grant and a specialized curriculum. UK's technology, developed by the College of Communication and Information, is tailored messaging.
Much of the research that I've done at the University of Kentucky has revolved around messages around HIV, STD, and pregnancy prevention. Dan's work with the Weather Service. How do we get messages to people that tell them shelter in place, or better yet, evacuate? Right? How do we get them to do that? And so tailored messaging is all about how do I give you a message the way you need it to get you to do what you need to do.
So we're taking this research and we're applying it to healthcare. You've been in the hospital for, say, a heart attack, and they're sending you home. You're probably a little scared, and you go home and suddenly you're in charge of your care. So we want to send tailored messages to these patients. Maybe it's something like helping them manage their diet or their medications. Things that seem very basic but can be very overwhelming to these patients. Part of what we're doing with the project is kind of coming up with a short survey that patients will answer, and that will help us decide, what we need to do to tailor this message specifically for them. We have an evidence-based arsenal of information about the kind of questions that you need to ask. When you're speaking to your doctor, do you often find it hard to understand what he or she is saying? Even though we've done a lot of research into this and we know what works, we don't know what might sell.
Teaching this 10-week crash course is one of the top entrepreneurs in the world, Stanford's Steve Blank, author of The 4 Steps to the Epiphany.
What Steve talks a lot about is that startups usually don't fail, especially technology startups usually don't fail because the technology is bad. They fail because they don't know how to get customers.
His notion is that a business couldn't conceivably succeed unless you know what customers are thinking. And so the requirement was to talk to 100 real customers, people that would actually write a check for the product.
As soon as you begin talking to a customer, you'll figure out that what you thought was either wrong, or a lot of times you may find there's even bigger opportunities, and that means shifting either what you're working on or the way that you're approaching going into the market. The team that we have working on this doesn't necessarily have domain expertise in the healthcare industry, so a lot of what we've been going through this last 10 weeks has been just some nose to the grindstone, trying to understand what's going on, where what we're talking about would fit, who are the players in the market.
We're looking at people who have heart failure. We know that the 3 big behaviors associated with heart failure patients are sodium intake. They have to reduce the amount of salt in their diet. They have to weigh themselves every day, because if they don't, if that varies, it can actually change the way the medication is acting and reacting. And then they have to take the medicine and do the exercises and do everything as it's prescribed. And if they don't, they're more likely to be readmitted. As of November, Medicare and Medicaid will not pay for readmits within 30 days. And on average, it costs $11,000 for a patient to be readmitted. If Medicare and Medicaid won't pay for that, somebody's going to have to. So it's in the best interest of medical facilities to try to figure out ways to reduce that readmit.
This is all great and well and good, but what's going to drive the real change for these hospitals is going to be Medicare and Medicaid are saying, do this. With healthcare, it typically moves in a very slow pace, and it's a very reactive market. And so with that kind of market, you have to go by what is going to force the change. And regulations are what typically will do that.
We see it as integrating with the systems that the hospitals already use. They use systems called electronic medical records, EMRs, and there's a lot of different pieces to those EMRs. So we'd like to be a piece of that.
Something that's called a personal health record to basically make it easy for patients to track all of their doctors' digital information, take all of your information, simplify it, make it something easy to digest and something that you can actually learn from for yourself. And so we feel like that we've got a new point of entry that these doctors who think, well, this is great science, now have a way to say this is great science and it just makes sense. It actually fits in our workflow.
So that way it would work in with the workflow of the hospital. And however they transmit messages to their patients. It might be via a patient portal that the patient logs into. It might be via text messages, emails, even a phone call. As we're talking to all of these people, they're getting excited about the product as well. So not only are we helping to develop our business model and to really clarify what's going to be the best product that we can produce, but we're kind of developing a list of people who are probably going to buy. In the iCore language, they call it an early evangelist. Someone who is so excited about your product that they're willing to pay for it even before it's perfect.
Probably the most rewarding part of the project has been the reaction that we get from people when we talk about our ideas. Again, we're academicians and we're not used to having to sell things, and so to finally have people say, you know, this is what patients need. This is what the healthcare system needs to right itself is pretty gratifying.
We can get the funding from these different organizations to test our messages, but then once we've got that, this commercialization lets us say, how do we make life better now that we know these things?
Personally, I kind of hope that this keeps going and that we can turn this into a full-fledged business and that, you know, I can help to run that over time. And I think that there's a definite need for this.